valuable. Of course, we began the hurricane season just about a week ago, and the Ministry of Health, Wellness, and Social Services thinks that it's appropriate to fill you in on how we have prepared for the hurricane season. While you're preparing your family and your businesses at home, we of course have to remain prepared for you in the event of an emergency or a disaster. Let me recognize the presence of the Permanent Secretary Acting in the Ministry of Health, Wellness and Social Services, Dr. Laura Esprit. We welcome as well the Chief Medical Officer Acting, Dr. Lenora Fevrier-Drygo, Director of Primary Healthcare Services Acting, Dr. Francine Jeffrey Louis, the Ancillary Manager at the Dominica-China Friendship Hospital, Doreen Fabian, Director of the Department of Social Services, Delia Giddings-Stedman, Community Health Nurse, Isana Moise Alfred, other members of staff of the Ministry of Health, and of course the Dominica-China Friendship Hospital. We welcome first to the podium Dr. Francine Jeffrey Louis. Again, she's the Director of Primary Healthcare Services Acting.
Good morning, members of the press, healthcare professionals, and the citizens of Dominica. Ladies and gentlemen, as an island that has suffered through and survived its fair share of storms and hurricanes, we are no stranger to disaster, and we have learned to never underestimate their potential for destruction. As the Director of Primary Healthcare Services Acting, I am also the Health Disaster Coordinator of NEPO, which means I am tasked to ensure that our health facilities are ready to withstand disasters and are prepared to serve you in any event. Given our vulnerability to hurricanes and the unpredictability of these natural disasters, it is imperative that we take proactive measures to ensure the safety of our citizens, while we minimize the potential health impacts of these storms and limit the interruption in services. Our healthcare district preparedness. Health centers play a crucial role in the overall preparedness and response efforts during the hurricane season. We have a total of 49 health centers on island, to include the RFA hospital in Portsmouth. To enhance preparedness for the hurricane season, the 7 health district teams have undertaken the following measures. Emergency response plans. Health districts develop and maintain comprehensive emergency response plans that outline procedures for handling various scenarios during a hurricane or tropical storm. These plans include protocols for evacuating patients, securing medical supplies, ensuring staff safety, and coordinating with other emergency response agencies. These plans are reviewed yearly prior to the commencement of the hurricane season. Stockpiling medical supplies. Health centers stockpile essential medical supplies, medication, and equipment to ensure continuity of care during and after a hurricane. This includes items such as first aid supplies, medications for chronic conditions, personal protective equipment, and backup power sources for critical equipments. Each health center has already reviewed their disaster boxes. Staff training and drills. Health center staff undergoes regular training on emergency response protocols and participate in drills to simulate hurricane scenarios. This training helps ensure that staff are prepared to respond effectively in a high-stress environment and can provide care to patients under challenging conditions. Districts have carried out simulation exercises depicting various scenarios of emergencies. As recent as this week, 14 health professionals attended a rapid response and incident command center training in Grenada, facilitated by CAFA. In May, PAHO facilitated a 3-day workshop and trained 30 individuals on Health Emergency Operations Center. Communications and coordination. Health centers establish communication channels with local emergency management agencies, hospitals, and other healthcare facilities to facilitate coordination and information sharing during a hurricane. Clear lines of communication are essential for ensuring a coordinated response and allocating resources where they are most needed. To date, our health districts have received two-way radio training in the use of HF and VHF radios. In community outreach and education, health centers in collaboration with the Health Promotion Unit engage in community outreach and education initiatives to raise awareness about hurricane preparedness and the importance of seeking medical care promptly during a disaster. This includes disseminating information about evacuation routes, shelter locations, and health risks associated with hurricanes. Infrastructure resilience. We have infrastructures that are more resilient to withstand the impacts of hurricanes due to reinforcement and renovation of buildings and the constructions of new buildings, the installation of backup power systems, and the securing of water sources. These measures help in ensure that the health centers can continue to operate and provide essential services during and after a hurricane. While the health centers are getting prepared to withstand any storms or hurricanes, it is crucial for families to always have a comprehensive plan in place to ensure the safety and well-being of their loved ones in the event of a hurricane or any natural disaster. Developing a family plan is essential for preparedness, response, and recovery during times of crisis. Here is a guide to help families create a solid plan for hurricane preparedness. 1. Establish communication channels. Ensure that all family members know how to communicate with each other during an emergency. Designate an out-of-area contact person that each family member can reach to provide updates on their whereabouts and safety. Keep a list of emergency contacts, including local authorities, emergency services, and medical facilities readily accessible. Create an emergency kit. Assemble an emergency kit that includes essential supplies such as non-perishable foods, water, medication, first aid supplies, flashlights, batteries, a portable radio, and important documents, passports, insurance papers, certificates, even your wills. Customize the emergency kit to meet the specific needs of your family members, including infants, elderly individuals, and pets. Identify evacuation routes and shelters. Familiarize yourself with evacuation routes in your area and know the locations of designated shelters. Plan multiple evacuation routes in case some are impassable during a hurricane. Determine how you will reach the nearest shelter if evacuation is necessary, and ensure that your family knows the way. Secure your homes. Make necessary preparation to secure your home before a hurricane, such as trimming trees, securing outdoor furniture, and reinforcing windows and doors. Identify safe rooms within your homes where your family can seek shelter during the storm, and ensure that everyone knows where these rooms are located. Stay informed. Stay informed about weather updates, hurricane warnings, and evacuation orders by monitoring local news, radio broadcasts, and official weather channels. Follow the instructions provided by local authorities and be prepared to act promptly based on the latest information. Practice your plan. Conduct regular drills with your family to ensure that everyone is familiar with the family emergency plan and knows what to do in various scenarios. Review and update your family plans annually, taking into account any changes in family dynamics, contact information, or emergency procedures. By developing a family plan for hurricane preparedness or any other emergency, you can protect your loved ones and minimize the risk associated with these powerful storms. Remember, preparedness is key to staying safe during the hurricane season. Stay informed, stay connected, and stay safe. I thank you.
Thank you so much to Dr. Francine Jeffrey Louis, Director, Primary Healthcare Services, acting. And as she said, we can never underestimate the potential impact of the weather conditions. So we ask that you stay prepared. And of course, the primary healthcare services, they'll stay prepared so that we can have as little interruption in services as possible. For those of you who have family who may be at the hospital, Of course, the hospital has its own preparedness plan so that you can be confident that your family will be in safe hands in the event of a disaster. To tell us more about that, we invite the ancillary manager at the Dominica China Friendship Hospital, Doreen Fabian.
Good morning, all. I am Doreen Fabian. I'm representing the Chief Executive Officer, Dominica Hospitals Authority. I will seek to walk you through our level of preparedness for both the Dominica China Friendship Hospital as well as the Marigot Hospital. Currently, at Dominica China Friendship Hospital, our bed capacity stands at 320, with an average of 30 beds per ward with 2 isolation rooms per ward. Our disaster plan. The hospital plan has been updated, and this includes departmental plans, the action cards, and our staff list. A simulation exercise to test our plans will be conducted shortly. Sensitization of staff in various departments has commenced. Members of the EOC and alternate members are preparing for a refresher course, and that should be done very shortly. Our disaster boxes in all departments are being reviewed and restocked as I speak. The Marigot Hospital disaster plan is in draft form to be finalized in the coming week. Let's look at our structural part of our hospital. Reassessment of both facilities, and that is Marigot Hospital and Dominica China Friendship Hospital, using the PAHO Rapid Assessment Tool for operations and physical plant is in progress. However, all patients' buildings have been reinforced concrete roofing slabs, and the provision has been made for the use of sandbags to manage water ingress, as well as boarding up of exposed and vulnerable areas. I will move to speak to the non-structural aspects. Our generators. Currently, at DCFH, Dominica China Friendship Hospital, we have 4 generators with automatic switching, enough to run the entire facility for 3 days at full capacity, and can be extended to 5 days if non-essential departments are cut off. I can say that they are in good condition and tested weekly, and is expected to be serviced within the next week or so. Our fuel storage is up to 2,000 gallons, and that is 3-day supply, which can be extended with load shedding. Marigot is also equipped with a 400 kVA generator, functional and installed, and with fuel storage of 90-gallon tank, sufficient for 1 day at full load. However, we are in discussion to increase the capacity to at least 500 gallons, and that will put us to 5 days. Our water supply. At DCFH, there are 2 water cisterns on site with combined capacity of 75,000 gallons, and that is 3 to 5 days supply. To support this, we also have 10 1,000 plastic water tanks, which are placed in strategic locations, and smaller drums as well on the wards for immediate use. Marigot is also equipped with its own water system. Medical gases. The hospital has on site an oxygen concentrator with a capacity of bottling 50 bottles per day. Currently, we have 100 cylinders in reserve and 320 in circulation, and also a central medical gas piping system which is connected to 20 cylinders at the bank. Our medical equipment. Medical equipment in the operated theater and recovery room is functional and is in excellent condition. Our imaging equipment, to include our CT scan, our MRI, our X-ray machines, and ultrasounds, are also functional. Our food, water, and cleaning supplies Currently, procurement of a 3-month supply of these items are ongoing. Our human resource and accommodation. Duty rosters for first responders and relief staff have been prepared. Staff on duty are required to report at warning stage and are always encouraged to walk with their personal effects or their go bags. Our on-call staff remains in their respective department during the storm while relief staff are accommodated on compound. Staff lists have been updated to include telephone numbers and addresses, as well as our action cards and our refresher courses are ongoing. I speak to our staff accommodation. I can tell you we have a dormitory with 14 rooms, 2 beds per room capacity, a hostel with 14 single rooms. The Alford and Emery ward will be converted to staff accommodation site with cessation of elective surgeries and discharge of non-critical patients. At Marigot, we also have a dormitory which is located downstairs, the basement of the hospital. We have on compound a functional ambulance and also a truck which is used to move our oxygen from the plant to the various locations. As well as, I can say we have 5 days free fuel for all our vehicles on compound. That includes 45 gallons of gasoline and 45 gallons of diesel. Our pharmaceuticals. Basic supplies are available on the ward and additional stock can be obtained from the central medical stores upon request. Our Information, Communication, and Technology Department, I can tell you we have functional lines on all wards and departments. The availability of cell phones to all managers and departments. The availability of handheld radios for EOC members. However, we need to procure an additional radios for all our supervisors, and this is in progress. Our VHF radio is installed and functional both in the EOC and Accident and Emergency Department, while installation of an additional antenna is ongoing at our alternate EOC. Installation of an HF antenna at Marigot is also ongoing. Our patients. Prior to a storm, patients are assessed and discharged as necessary to make provisions for incoming casualties. They are discharged with instructions, medications, and appointments for early follow-ups. Our dialysis patients, we can't forget, are dialyzed as close as possible to shutdown time and are encouraged to remain, if possible, in close proximity. I must highlight that this is one of the outpatient departments that we try our utmost to reopen the soonest. I can boast for post-Maria, we were functional within 3 days. Patients are to ensure that they have adequate supply of medications and are reminded to follow their recommended diets. While the Accident and Emergency Department, both at Dominica China Friendship and at Marigot, remains open and functional, the public is always advised that during the passage of a storm, only dire emergencies should come, since they should not be out facing the elements. They are encouraged to make use of their health centers as much as possible during those times. Eternal evacuation is also part of our disaster plan. Discharging of non-critical patients and housing the small population together in 1 or 2 wards. To complement our level of preparedness, I wish to inform that we have a cadre of dedicated, committed, and competent staff who always respond during an emergency. I pause to say thank you. Let me take the opportunity to remind them, that is, our staff, to prepare and update their family plans. In closing, I wish to reassure the general public that preparations are being put in place to ensure the safety of our patients and staff, and we solicit the cooperation of the public at all phases. Thank you.
And thank you so much. Our thanks to the staff of the hospital for their attention to detail and for their diligent effort to ensure that the hospital is ready in the event of any sort of disaster. Thank you so much once again. Of course, under the auspices of the ministry, the Social Services Department is also part of our family. And we cannot forget that there are vulnerable groups who require special attention. And that's where the Department of Social Services comes in. So we want the director of the department to tell us how they're preparing the institutions under their care for disaster. So we welcome to the podium Mrs. Delia Giddings-Stedman.
Good morning. Okay, the Department of Social Services play a critical role in working with vulnerable groups, the children, the elderly persons, and persons with disability, and also the homeless. Our key role during and before and after a disaster is to ensure that the lives of the most vulnerable citizens are secured, to include children, the elderly, homeless, and persons with disabilities, that institutions associated with residential care of citizens is always in a state of readiness in the event of a hurricane or natural disaster, including providing relief supplies, and to provide support in helping victims of disasters cope and recover after the aftermath of a disaster. To date, the annual NIPO checklist for disaster preparedness for all government-sponsored residential and other private homes for children and the elderly have been completed. Residential homes to include the Dominica Infirmary, Community Hostels Inc.'s Grotto Home for the Homeless, Maho Home for the Aged, Northern Home for the Aged, House of Hope at Daly's, Children Home for the Abused, Neglected, and Emotionally Scarred, Chances at Jimit, the Operation Youth Quick. The private homes include FACS, Agape Care Home, and a New Age Residential Care Home. All homes have a disaster plan and are in a state of readiness in the event of a disaster. They are equipped with water tanks, generators, support staff, cell phone for communication, storage for food. There are also assigned vehicles for transportation to include the fire and ambulance service to transport vulnerable groups to shelters when a warning is given. Shelters have been identified for institutions that may require relocation in the event a hurricane warning is issued. There is also data available on the number of residents at each residential facility to ensure that everyone is accounted for. We have compiled a list of names of clients of the non-governmental organizations reaching the elderly, abandoned, citizens that are housebound, rich, who will require transportation to a place of safety with the support of the fire and ambulance services. Like everything else, post a disaster, persons suffer with emotional stress, fear, trauma. And at the department, we have a team of trained counselors to provide psychosocial support for families in the aftermath of a hurricane. And at this point, I want to focus a little bit on our children because they are very vulnerable, especially when they're in shelters. Children and women are one of the most vulnerable people or community or groups of persons that fall prey in shelters. And we would like to encourage parents to understand that safety is critical for younger children and their whereabouts should be monitored and supervised at all times. Do not leave children unsupervised in a shelter. So if as a parent you're going to find food, you're going to find some medicines for your children or anything that you're going to do while in a shelter, ensure that these children are supervised by an adult or someone you trust. All shelters should provide a safe space for children and women who are usually the most vulnerable in the shelters. And we're hoping that the shelters, the women would have the safe space would include an area where they would have privacy. Because in shelters, everything is open up, so we're hoping that they would have privacies within the shelters. Young children should be accompanied to the bathrooms. Parents should ensure that medicine for children with health conditions and special needs are placed in a secure bag, and medical conditions and special needs should be reported to the shelter managers. Ensure that there is always safe drinking water. Create a supportive environment so that children can feel safe. Spend time together. Give extra support and care. Listen to your children. Validate and accept their feelings, because at that point, children tend to be afraid. They're traumatized. And if in case the children tell you anything that we were in the shelter, take their word for it. Investigate it. Don't brush them off. So we validate whatever they say, and we work with them. Stick to routines. Like children work better when they're in a routine environment because they are within the home, they have a particular routine. If they go to the shelter, try to ensure that this routine can be continued. And as I end, I urge everyone in creating an emergency hurricane preparedness plan to ensure that special attention is placed on protecting children, the elderly, and persons with disability. Thank you.
Thank you so much, Mrs. Stedman and the Department of Social Services. And as we wrap things up, I'd like to invite our community health nurse, Isana Moise Alfred, just to reiterate some of the things that you need to do to prepare for a disaster. Of course, whether you're at a shelter, whether you're at a home for the aged, any type of institutionalized care facility, there are things that you can do to help yourself. So we welcome again to the podium Mrs. Isana Moise Alfred to do her presentation.
Good morning to everybody. Good morning to the listening public. So given that we have already entered the hurricane season, it is my expectation that the general public have already taken steps in the preparedness phase of a disaster or hurricane. However, I'm here to just give you a few reminders and pointers on what your personal responsibility would be to ensure that our rehabilitation phase after disaster and recovery phase after disaster goes smoothly if our preparedness phase is done properly. So, what is your personal responsibility? First, when we are facing a disaster, it's an anxious phase. It can be a very stressful phase. So for those of us who already have medical conditions, and we more refer to, let's say, high blood pressure, diabetes, asthmatics, it is important that we get our medications even prior to a disaster happening. So we do not wait until a disaster is there, and then we try to get medication. It is important that we get our medication in the preparedness phase, and we get adequate enough medication. So those of you who have prescribed medications from all your doctors on a monthly basis, it is vital that you go to your pharmacist and you get an additional amount of medication that can be stored away and stored in a proper manner. You ensure that you store your medication so that it maintains the integrity of the medication. For example, those of us who are on insulin, we make sure that our insulin is stored in a manner that in our plan, if after a disaster or hurricane happens, how can we store that insulin when there is no electricity? And how that is done, you can store your insulin in a cooler with some cold water and some ice so it can maintain its integrity and be effective. Okay? For those of us who are like the asthmatics, you make sure that you have your Ventolin puff You have those of us who have our personal nebulizers. It's okay to solicit and get the medication from your pharmacy. You go to your medical doctor, make sure your prescription is also up to date, and so that you can be able to source your medication. Our medications you can get from our local pharmacy. You can also get it from the pharmacy at hospital. For those of us who get other medications from the private pharmacies, we ensure also that we purchase an additional stock and amount of those medications so that we have them readily available. Okay. Ensure that you store not only your medication, but your medical records in a proper manner. Ensure that your medical book, not just your medical book, but if you have results, if you have any little x-ray, any CDs of any medical conditions or tests you have done before, ensure that these are stored properly, because your medical record is what serves as a guide for whoever will be providing medical attention to you after a disaster. So you can imagine, you are not from this particular district. However, you so happen to be there spending time with your mom during a disaster. This doctor or this medical team is not aware of what your medical condition is. However, being in an unresponsive state after a disaster, they would need guidance as to how to care for you. Your medical record serves as this guide. So it is vital that we not just save and protect our medication and our bank books and all our other information and our passport, but our medical records and doctor books. Okay? For those of us who have been soliciting medical assistance from our private physicians, especially our antenatal clients, it is important that you communicate with your district at your district level, allow them to know of your status and where you are at the moment. If you know that a hurricane or a disaster is approaching, ensure that you discuss with your district team as to these are the individuals that are within my home. Those of you who have vulnerable clients, the children, we have elderlies who are incapable of taking care of themselves. We have clients who may be immobilized because of broken bones. If you are home in a particular district, your responsibility or the responsibility of your family is to ensure that this information is communicated to the district medical team so that we are aware at a district level what category of clients are within the community that may require our assistance in the event of a disaster or after a hurricane. All adults at this moment, we are in the preparedness phase. And so I'm here to also encourage you to get vaccinated with your tetanus vaccines and your influenza vaccines. We know that after a hurricane, we are prone to get the flu. So we can get now our vaccines, which will serve as a form of protection. Remember, vaccines are preventable. They are not a cure. So a tetanus shot after a nail prick is not going to affect or cause an effect at that moment of that nail prick. However, you can protect yourself in the event that you do get a nail prick, that you protect yourself against tetanus by getting your tetanus vaccine at this present moment in your preparedness phase. So vaccination should be part of your preparedness phase. For those of us who are in the public, ensure and remember that, I will repeat, I think every presenter has presented on it, that during a disaster, we stay indoors. During a disaster, it is only individuals who really dire emergencies that will be seen at a casualty level or a health center level. However, it is pertinent and important and valuable that we remain indoors. The health district nurses will be remaining indoors, whether it's at the health centers. Those of you who are at home, the clients, we encourage you to stay indoors, because during a storm, when things are flying and you are putting yourself at risk, after a disaster, you wait for an all clear. An all clear is given by trained individuals who will come and do an assessment and say, okay, it is safe that we now proceed out. In the event that an all clear is given and you have a family member or you yourself require medical attention, you seek medical attention in the health district or health center that is nearest to you. The health centers, as Director said, are equipped and readily available to provide medical assistance if the need be. So you go to your medical health center and your doctor, your nurse, your midwife will then provide assistance to you in the capacity of what you would need at that time. Okay. It is important that we now put all efforts in place so that we ensure that when a disaster happens, in the recovery phase, it is smooth. If we do not, like I started by saying, if we do not prepare properly, it means that it is making the recovery period a longer period. After a disaster passes, immediate emergency care is usually a priority of what is given at the district level. So at the district level, the health centers, you will have antenatal clients getting priority, and we'll be dealing with priority clients. However, if in the preparedness phase, individuals take responsibility to ensure that they have their first aid kits, and you have in your first aid kits, you can have a little bit of paracetamol, a little bit of Benadryl, a little bit of the normal Limacol, Baron, the rubs that we may have, a little gauze and cotton. We ensure that you can have that at home, so that in the event you have little minor cuts and bruises, somebody with a little fainting spell, you can apply those measures, first aid measures, to ensure your family and relatives are okay. Immediately after a disaster, like I say, if you really require emergency care, you go and you solicit so from your medical team that is nearest to you. If you do not do this, then it means that in the event of the hurricane, during the hurricane, when this disaster is happening and you have that emergency without being prepared, you now want to go and get medical attention, which is putting your life at higher risk. So if you now prepare, then you help with the recovery phase and make it better. Thank you very much.
Thank you so much to Nurse Alfred for her presentation. And thank you again to all the other presenters for joining us this morning. We thank our media partners for always collaborating with us, and for short notice whenever possible, making their presence felt and bringing the information across to the general public. Before we leave, I want to just give a reminder to the general public. Essential workers are human beings too. Oftentimes we think that they are superhuman, and we forget that they too have families, they too have loved ones, that even while they're providing care for us, they're concerned about those loved ones as well. So during this hurricane season, I urge us to just practice a little bit of empathy when we come in contact with our essential workers, medical teams, fire, ambulance, police, social services workers, the social workers, the counselors. A little empathy goes a long way, because they too suffer from the same anxiety, the same traumas that we do, but they continue to put themselves forward to give us the best service possible during times of chaos and times of disaster. So again, we want to thank you all for tuning in, and thank you again to the media for your support. Have a good day, everybody.